Good afternoon, all. My name is HWillis, and today I will present my personal plan for innovation and leadership in a DNP role. I will discuss my current strength, how I arrived at my personal philosophy, my plans to apply these skills areas of opportunities I can develop these skills, and finally my plans for creating these opportunities. I hope you will enjoy my presentation as much as I had fun creating this PowerPoint. Current strengths. My current strengths as a leader and an innovator are: I choose to be a leader. By this I mean by obtaining a DNP degree, I've chosen to be a leader to assist in making changes by incorporating evidence to enhance population health and safety. I behave or act as a person others would want to follow. I act exactly how I would want my leader to be, such as being honest, behaving ethically, and giving followers hope and providing inspiration. I provide a vision for the future, communicate the goal and how the future will look with this change, assure people understand the goals and are on the same page and have given ample input to create the goals. Provide inspiration. I provide inspiration by being a good example, care about others, encourage others, share my experiences, be vulnerable, tell stories, and be a good communicator. Challenge people to be their best. Read, read, and read, to stay informed, and finally to be inspired myself by looking for others that motivate and inspire me. I make others feel important and appreciated. I communicate to others that without them I would not have come this far, as well as the unit or the organization. I show them that others need them as well, challenging them and recognizing them as individuals. I live my values and behave ethically. Some of my values that I convey to others by living this way is integrity, respect, individuality, ambition, diversity, loyalty, teamwork, accountability, honesty, compassion, optimism, independence, and innovativeness, to name a few. I try to establish an environment for continued improvement, showing others there is always a better way to do something, helping others learn that better ways make the department look better, make them feel better about themselves, and prepare them for a promotion into a different job. Personal philosophy. My personal philosophy. My perspective of practice follows the nursing philosophy of holistic nursing, where the patient is the focus and not his ailment. The patient is a whole person with his or her experiences and beliefs who belongs within a culture that has norms. The role that I can play is to facilitate others being heard and assist them in reaching their potential. As my experience in the nursing field has expanded from novice nurse to advanced practice nurse, so has my leadership skills. There are several leadership theories that I have encountered and utilized, but the most appealing theory that I have applied in practice is the transformational leadership theory. Transformational leadership focuses on positive construct of hope, resiliency, efficacy, optimism, happiness, and well-being. Transformational leaders stimulate and inspire followers to achieve extraordinary outcomes and in the process develop their own leadership capacity. They help followers grow and develop into leaders by responding to the individual followers' need, by empowering them, and by aligning the object and goals of the individual followers, the leaders, the group, and the larger organization. The transformational leader utilizes the four core components of idealized influence, inspirational motivation, intellectual stimulation, and individual consideration. Another influence in my professional philosophy is Hildegard Pepla's theory of interpersonal relationships. Hildegard Pepla, a legendary nurse theorist, introduced the theory of interpersonal relationships in 1952, arguing that the purpose of the nurse-client relationship is to provide effective nursing care leading to health promotion and maintenance. Within the nurse-client relationship, the nurse adopts one or more of the 6 helping roles when providing care, which are stranger, resource person, teacher, leader, surrogate, and counselor. Originating within psychiatric nursing, interpersonal relationship was the first nursing theory to recognize the therapeutic value of an interpersonal process. Plan to apply the skills. My clinical scholarly project is about the use of text messaging support to enhance smoking cessation and abstinence. Throughout my clinical scholarly project, I plan to apply the following skills. Choosing to be a leader by volunteering to be a change agent in implementing the text message support to enhance smoking cessation of the adult patients of the Community Health Center Clinic in San Luis Obispo County. Being the person others want to follow by showing honesty, integrity, optimism, ambition, while collaborating with employees and stakeholders at CHCC. I will provide a vision for the future by showing enthusiasm for the project, clearly articulating the goal of smoking cessation with text message support that will decrease the severity of patients' chronic health conditions, resulting in better patient outcome, and would place the clinic organization as a whole in a better light in the community. Provide inspiration by instilling hope into the employees that they can and are capable of making a difference and making them feel important and appreciated by recognizing and praising contribution they make to make the text messaging support project to come to life, relaying that they are a crucial part in making this a success, while collaborating with the employees, patients, and stakeholders of the Community Health Center Clinic. I will live my values of being honest, being respectful, communicate effectively, and ultimately to not hurt them. I would establish an environment of continuous improvement by listening and communicating effectively and encourage others to do better. I would also recognize conflict and differences by being open-minded and be present mentally and emotionally. Areas of opportunities to develop those skills would be finding leaders or mentors that have the qualities I'm looking for, such as integrity, honesty, ambition, individuality, optimism, diversity, etc. Lifelong learning about leadership theories, new treatments, and advancement in treatment. Enhance my abilities to appraise and synthesize evidence, and enhance my ability to disseminate evidence and diffuse change. Plans for creating these opportunities. Being an active member in my local California nurse practitioner chapter and lobbying for policy changes or enhancement. Keeping abreast of new treatment issues and enhancement and new laws and policies. Reading academic journals. Publish articles and or conduct poster presentation of issues I'm passionate about and an expert in. Conclusion. My philosophy was inspired and developed with influences of transformational leadership theory, Hildegard Pepla's interpersonal relationship theory, and the DNP essentials. As a DNP prepared advanced practice nurse, I will be a leader at the most advanced level of education. This would allow for independent practice, creation of scientific foundations, a leader in organization and system levels, offer quality healthcare, ensure patient safety, identify system issue, and facilitate organization-wide changes in practice delivery while utilizing technology and information literacy. And these are my references. I hope you enjoyed my presentation. Remember, leadership is the ability to inspire others to move towards a positive goal of our planet and the people on it. It is defined by your behavior, your actions, and your words. Dr. Michelle Dickinson. Thank you.